Morning you guys, it's Karen and I'm back. It has been a month since I have filmed and I know that some of you still don't know what's happened because I've had a few emails asking if I'm okay, etc. So for those of you that don't know, my dog Watson, the Labradoodle, had cancer. We found out he had cancer just after Christmas, and so I decided that I would just take some time off to look after him, help him recover from surgery, because he had a very nasty surgery. I'll put a picture in. Some of you will be fed up of seeing the picture, but I just am so amazed how quickly dogs can recover. The extent of this surgery, if it had been a human, we'd have been like, oh, I need 6 months off work and, you know, can you pass me the remote? We'd have just been so wimpy about it, I'm sure. And yet Watson has recovered amazingly. We only found out a couple of weeks ago that he is free of cancer. They got it all, they got clear margins, and it hasn't spread anywhere else, because this is one that they don't know until they do various tests and scans and whatnot. So we had to wait to get to the cancer centre and all of that. So we now know that he is cancer free. There is a 33% chance that he can get another one of these mast cell tumours, and that's quite common in dogs that are prone to these type of tumours. So we know another Labradoodle that has had 4 in 2 years, and the lady we saw at the cancer centre is treating a dog that has had 8 in 2 years. So we have to be extremely vigilant now about any lumps and immediately get them tested, and we go every 3 months to the cancer centre and they check as well, you know. So it's been a really tough time, really tough, because we were devastated when we found out, because, you know, for those of you that know, I know that not everybody on here is a doggy person, but and that's why I don't talk too much about Watson here on this channel. We've got our own channel, Mrs. Ginger and her dog. But for those of you that don't know, Watson is our only child, if you like. We do treat him like a child, but we still treat him like a dog. But he is our world. We plan our lives around him and adore him. But he's had a lot of health issues. He's had colitis, hip dysplasia, and allergies, and we've been fighting those ever since we got him. And he's now 4 years old, and we just got on top of all of those things. We finally felt like we'd given him some quality of life and some health, and then we got this, and it was just like, how much is this little boy expected to take, you know? And now he has kennel cough, would you believe, after all of that. So I didn't come immediately back to YouTube when I found out a couple of weeks ago, because I'd kind of put everything on hold with Watson being ill, and so there was quite a bit to catch up on. And one of the things that happened whilst Watson was ill was we had not a flood, but there was a leak from upstairs, and all of our wall in the living room, that came down, and bits of the ceiling. And so I'm still waiting actually for that to be decorated. I've been trying to get quotes, people have come out, and it's just all been a bit of a mess. I also had done some decorating. I was trying to keep my mind off things by cleaning and decorating while Watson was recovering and while we were waiting for results, etc. And also I've been kind of struggling with my own health as well. So that's why I haven't immediately been back. I have still been doing a little bit of YouTube, in that I did Watson's full cancer story video over on Mrs. Ginger and her dog, because that was a request. And I had intended to do it anyway so that it would help people going through the same kind of experience. And I was also doing my Patreon subscription channel videos once a week. So I certainly haven't been sitting twiddling my thumbs. We booked a holiday. I think people thought I was immediately going on holiday, because I'd mentioned that, you know, if we got good results, we would be booking a holiday. But unfortunately, Kev's, you know, has to work and can't just take time off like that. But we have booked a holiday to the Lake District for myself, Kev and Watson, but it's not until the end of April. So there's a while to wait for that yet. My health, yeah, like I said, I've been kind of struggling with my health. Nothing new there. I've been having these headaches for years and years and years, and I'm actually thinking of doing a dedicated video to migraines and headaches, because I have got some really good coping mechanisms, but I'm waiting on the results of a blood test to, I don't know why this makes me smile every time I say it, but I'm waiting on the results of a blood test to see if I possibly have a brain tumour. Maybe it's just a coping mechanism, is just to smile when I think about it. It would just be so, like, really, you know, a brain tumour on top of everything. But honestly, I don't think that that's what it is. But do you remember I told you that I'd had a blood test, and I alluded to the fact that I was having some health issues myself, but they just seemed so minor in comparison to what Watson was going through at the time. It didn't really matter to me. But I've just had the second blood test. What it was is I had a blood test and it showed that I had high levels of something called prolactin, which is a hormone. Now this can be high either through pregnancy, which that's not the case with me, through medication, which the doctor says I'm not on any medication that should make the levels that high. And so the only thing left really is this prolactinoma, which is a brain tumour. But it isn't a cancerous brain tumour. It may require surgery. It's really a choice. It's not something you have to have operated on, depending on how it affects you. But the way that they test, because when I told, you know, some of my family, they were like, oh, well, you know, are you getting a brain scan and what's happening, you know? And I was like, it's not like that. What happens is they have to wait another 2 months to see if the levels increase, because it's a very slow growing and it's a slow moving hormone. And so they'll do another test in 2 months and see if my levels have gone up or if they go down. And if they go down or stay the same, then it's absolutely fine. And I just happen to have higher levels. If they've gone up, I will be sent immediately for a brain scan and take it from there. So it's not something that's particularly been worrying me. Like I said, I was more concerned about Watson actually, and that probably kept my mind off it. But I have really been struggling with headaches. So I started with a new physio last week, and at the end of last week, and she's taped me up. Actually, it's lasted really well. So I've got like taping on my neck, and that seems to be helping a little bit. So hopefully between the results of these blood tests and the new physio, hopefully things will improve. If the blood test is negative, then I'm getting another referral back to neurology, which I've been to before, so that may help as well. So going forward, I've got a lot of videos to catch up with for you guys. So for example, I've got a lot of empties. I've got just a generic empties, but I've got brand empties like Alex Steiner Cross Primark, Inky empties, things like that. Then I've got hauls because I've obviously bought some stuff. Favourites, I've got favourites to tell you about. So there's quite a few videos I need to put up, but let me know if I've forgotten anything. If there was anything you guys were waiting for, let me know. I was possibly going to do the assumptions tag, but I have to say I've seen a lot of comments, either from people that feel like they don't really agree with it because they think it's a judgmental thing, which I'm not sure I do, because a lot of the responses that I got, I feel quite flattered by. You know, that you can have a positive assumption. It doesn't have to be negative. And I haven't got any negative assumptions actually. But the other thing is I think people are a bit bored of these assumption videos. So let me know what you think and I can possibly do that video for you. Okay, on to eyes and my eyelid surgery update. So I feel that I am in exactly the same position now, or I feel the same as I did more or less immediately after surgery. And we are at nearly, in a week's time, it will be 3 months since I had the surgery. I had it on the 5th of December. So on the 5th of March, it will be 3 months exactly. And what I said immediately afterwards was that I could see I still had hooded eyes, but that the skin was smoother. When I went and had my stitches out, he mentioned that I may have something called brow compensation, whereby my brows have been pulled down by the tightening of the skin in my eye area. And as I told you guys, I wasn't aware of that. That wasn't something he had told me. So there's been a lot of strong opinions and a lot of comments on this, and so I want to address some of those. Firstly, a lot of people are angry that he didn't tell me about the brow compensation. I agree, but even if he had have told me about the risk of brow compensation, unless he told me it was 90% chance, you know, I don't know what the statistics are, I probably would have gone ahead with the surgery anyway. So that's the first thing. It wouldn't have changed my decision making. It wouldn't have changed me having the surgery or not. The other thing is that from my little bit of research, I can't see that there's any way brow compensation can be avoided. It is just one of those things that may happen to some people. And so again, I don't think, there's some people are saying he needs to do the surgery again because of this brow compensation, but it's not something he did wrong. It is just a risk of surgery. There are risks with any surgery, and I'm aware of that. Another comment is that I'm not a surgeon, therefore I can't come to these conclusions that it is brow droop. And again, I kind of agree with that, that I'm not a surgeon and I don't know 100% that it is brow droop. But my revision appointment with him is not until the 2nd of April or the 3rd of April. I can't remember the exact date, but I don't yet have my revision appointment with him. So of course I'm going to come to my own conclusions, and I am experienced in research. That is my area of knowledge. And so I have researched it the best I can and come to the conclusions from knowing my own face and knowing my own eyes. And so I don't think it's ridiculous, you know, the conclusions that I've come to. But I do accept that I am not the expert, and so I will, of course, go to the appointment and see what the expert says. I can't see him, well, I could see him earlier. The nurse did say you can go and see him earlier than your appointment, but he won't even discuss any kind of revision, any kind of corrective surgery, any other options until that point, because their practices in that hospital and especially that surgeon is that until that 4-month period is reached, that full healing and full benefits have not been reached. And so I understand that, and so there's really no point in me going back before that appointment. The comments about I need to have the surgery redone, I don't think I need to have the surgery redone at all, because do you remember I told you that the way he told me this, the way you test to see if you are a candidate for upper eyelid surgery is to see if you can pinch enough skin here and pull it out without it pulling your brow down and without it pulling your eye open. And I suppose actually that's one way you can avoid brow droop, is not take too much skin. If you take too much skin, you might end up, if you took too much skin or took it too high, you could end up pulling that brow down. Before the surgery, I had a lot of skin that I could pull. I don't have enough now. As soon as I move any, it pulls on my brow or it pulls my eye open. You have to do it with your eye closed, sorry, I should have said. And so I don't have enough skin now to do that. So I wouldn't want a revision because there isn't enough skin. I don't think I would be a candidate. But also, if brow droop has happened once, it's most likely that even if he did go, you know what, I'm going to go in and take a little bit more skin, my brow would just go further down again. You know, if I am somebody that is prone to this brow droop, it would happen a second time, most likely. I really don't think that a revision surgery, or a revision eyelid surgery is the answer. If you look at what the revision surgery would be for brow compensation, the usual revision surgery, it would be a brow lift of some kind. And brow lifts can be done either minimally or like they can be done in different ways. They can be done, it's almost like keyhole surgery and major surgery. But they are all done at the hospital that I went to under anaesthetic, under general anaesthetic. And that's not something that I wish to have done. I'm not going to go under general anaesthetic. And it's funny because there are a lot of people that have said that I was brave for having it done under local anaesthetic, but I would think the other way around. General anaesthetic terrifies me. I've been under general anaesthetic for knee surgery and stomach surgery and different surgeries. And it's really, really scary, and it's a horrible experience in my opinion, and something that I will only do if I absolutely need to. Not something I would do for a cosmetic procedure. I don't judge anybody else doing it, you know, it's just that's my particular fears. And so brow lift is not something that I would go with, you know, even if he offered it. I don't think it's something I would accept unless he could do it under local anaesthetic. However, I can see how that would work because, like I say, what has happened is the skin has been taken off in the middle here and my brows have compensated by the skin has pulled down. So my brows used to be a bit further up, and so I can see how lifting up here would actually make a difference. That would kind of cause the eyes to look like the result that I wanted. He told me initially I wouldn't have been a candidate for brow surgery because of my brow position was very youthful. So it'll be interesting to see. You know, I'm not going to start off by telling him I wouldn't accept brow surgery. I'm going to just see what he tells me, what he offers me. It'd be interesting to see if that would have been an option. But that being said, you can achieve a little bit of lift of your eyebrows with Botox, and that's something I had before. I had Botox for, I think it was about 10 years in the end, and loved it. And I had it to hold my eyebrows in place, to stop all this wrinkling of the loose skin, and I really liked the result. I stopped having it done in the end because of the cruelty to animals, but there's now, Allergan have now confirmed that they use a different test. They do not use the lethal dose test on mice anymore. And so that's kind of taken that away, as long as I can find a company that uses Allergan Botox and not like Vistabel or whatever. But the only thing with that is it's the very thing I was trying to avoid. You know, even taking away the animal cruelty side, I didn't want to have Botox every 5 to 6 months, you know, because it's expensive, and you know, it's about £300 a time, so you're talking about £600 a year. So to me, I was having the eyelid surgery so that it was done for, I don't know, 5 to 10 years, and I wasn't having to spend that money every year and find somewhere, etc., etc. So now I've had that, then having the Botox on top of that, it is going to be a bit of a pain. It's not what I wanted, but it may be the solution. There's been no point having it now, because obviously when I go for my revision appointment, he needs to see it without Botox in. He needs to see exactly what's happening and how bad it is, if you like. And I can't deny that I'm looking forward to trying Botox and seeing if that does give me a little bit of a better result, because it will raise my eyebrows to how I look when I'm talking to you guys, and to how I look in the photos that I take, and in everything where people say to me, oh, your eyes are looking a lot better. It will sort of hold it in that position. Somebody asked me, will it look unnatural? I don't know. I just have to give it a try and see what it looks like. It's not permanent, you know. If it did look unnatural, if I did look surprised, you know, then it could be, it will only last a few months, and then I could have it done differently next time, and, you know, get to know exactly where I need the Botox. I feel like I already know that, to be honest with you, but I would be going to see somebody different this time. So I'm just going to put some pictures in here so you can see the before and after. So the before I had my surgery, and then what my eyes look like now with makeup on. And I'll see if I can take some pictures without makeup as well. But you can see that from my point of view, and I think a lot of people agree, my eyes are still hooded. You can still see very little of my mobile lid. One thing that I know Botox can correct is a bit of a bigger problem with my eyes that ironically may have been caused by Botox and may have been worsened by this surgery, and I will be showing him this. I showed this over on my Patreon channel. I actually showed you guys on Instagram stories as well, so you may have seen it. I have a problem with this right eye here. And what it is, before I had my eyelid surgery, I did notice that I'd sometimes be smiling in photos, and I'd lift my eyebrows or whatever, and I'd noticed that one eyebrow was lower than the other. And I didn't know why. I just thought that that was a little quirk, or I did think to myself, it's a little bit of a hangover from Botox, because remember, Botox weakens muscles over time. I didn't think much to it. However, since having the eyelid surgery, it has got a lot worse. And I know this because when I take pictures of my eyeshadow for Instagram or for videos or anything that I need a picture of my eyeshadow for, the way that I used to do it was, especially when my hooding was bad and I didn't like the way my eyes looked, is I would look down, and especially when it gives you a better idea of what the eyeshadow looks like. So I'd hold the phone, raise my eyebrows, look down and take a picture of my eyes. That was absolutely fine until after my surgery, and I'll show you exactly what happens now. And it's kind of comical. I showed it to my husband and he was in stitches. You've absolutely got to be able to laugh at yourself though, you know. So let me show you. So if I was taking a picture just now and holding the phone, I would raise my eyebrows and then I would look down. Now I can't feel anything, but I know, yeah, and as soon as I look at you, I can see this eyebrow has dropped, and so I'm able to hold this one up. And this one I can hold up again, I can lift it up again, but as soon as I look down, that drops. So there is a muscle or a nerve has been damaged on this side of my eye, which again supports the brow droop, because, you know, something is not enabling my brows to stay in their correct position. And actually, even if I hold my eyebrows up, this one slowly moves down. So even as I'm talking there, you can see it slowly moving down. So something has happened on this side, which, like I said, contributes to the theory of brow droop. The best outcome for me, I think, would be that my surgeon offers me lifelong Botox. But he doesn't do Botox as far as I know. He does surgery and he mostly does reconstructive surgery for cancer patients, reconstructive facial surgery for cancer patients. So I don't see that happening. The second option that would be okay with me is if he offered a facelift under local anaesthetic, but it would only be a very minimal one, because the one where they actually cut and lift has to be done under general anaesthetic. If he would be prepared to do the one under local, it would be one, it's a minimal one. That might be something I would consider. So that's where I'm at the moment. This is only, like I said, my feelings, my experience from looking at pictures of myself before and after, from how I'm used to seeing myself. I feel like when I'm doing my makeup, I can easily tell that my brows are lower, because, you know, the brushes that I'm used to using, I can put the crease on in one stroke, whereas I used to have to do it in two. I don't have to put as much on my brow there. There used to be a lot more space. You know, there's a lot of things that I feel support the conclusion that I've come to, but I do accept that it might be something completely different when I see the surgeon in April. I don't feel depressed about it at all, but I do feel differently about myself. It's a weird one, because I think at the time I was starting to reapply makeup was around about the time that we found out about Watson, because Christmas Day was the first day I was supposed to apply makeup, but my eyes are still a bit sore, if you remember. And then the day after Boxing Day is when we found out about Watson. And so makeup has kind of been really not very important to me at all. Now everything's okay again and I've started reapplying it. I am noticing that I look different, and I can't apply the makeup and achieve a look that I like. I don't want it to sound, like I said, like I suddenly hate myself, because I don't. But something similar happened when I had fillers. The only time I've had fillers, apart from my lips, I have had fillers in my lips a couple of times, but I had fillers in my nose to mouth lines, again, about, I don't know, 10, 12 years ago. And I did not like the result at all, because what it did was it puffed my cheeks up and it made me look a bit like a chipmunk. But it changed the shape of my face, and it was no longer my face. You know, it didn't look like me. I didn't recognise who I was looking at in the mirror. Now that can happen in a very minor way, like when you have your hair cut, when you have your hair colour changed, when I had my eyebrows done, I was just like, oh, it's just not me. It takes you a while to adjust to something different. It's taken me a while to adjust not having a black line under my eyes, you know, and now this is what I prefer. But that's how I feel at the moment with my eyes. I keep putting my makeup on and I'm not achieving the same result as I did before the surgery, which was that I did like the eyeshadow results I got. I just didn't like my wrinkly skin. But now I'm looking in the mirror and I'm like, that's not the me that I know. And actually I'm finding that different eyeshadows, I'm enjoying different eyeshadows that I didn't enjoy before. There was palettes that I had before that I was going to throw away that I've since used and I enjoy, and palettes that I absolutely adored before that I'm using now and I really like them. So I don't know whether that's just coincidence or whether that's anything to do with, you know, my new eyes, if you like, or it could still be a hangover from the Watson thing, whereby I still feel a little bit like I feel the shallowness of beauty. I know how important it can be, because I always said to you guys, you know, I wake up in really bad pain, and getting up and trying a new eyeshadow palette was the thing that got me out of bed despite the pain. And I would sit and take my painkillers and put my eyeshadow on whilst they kicked in. And so it was really important to me. But now that I'm not having to go to work, I don't have to get that makeup on my face. I feel a little bit differently about it. And like I said, I don't know whether it's just with all that's gone on with Watson and all that's going on with my own health, that it just makeup and beauty seems to be feels to me to be very low on the list. So it may just be that, I don't know. Or it may be just that this surgery was supposed to give me a lift physically and emotionally, and it certainly hasn't done that. So I don't regret it now, but we'll see how I feel after I've had my revision appointment, after I've tried Botox, if that is one of the options, and yeah, and then more time will have passed and I'll hopefully be back fully embracing the world of makeup. So if you've got any questions, of course, leave them in the comments. and I'll do my very best to answer them. Thank you so much for watching today. Let me know your experiences. It's really interesting hearing everybody else's experience, and I have seen some photos of other people that have had it done that look absolutely amazing. So, you know, don't necessarily let what I've gone through put you off. Hopefully you can just learn to ask questions and to know what to expect could happen. So yeah, that's everything. Thank you very much for watching today, and I'll speak to you again soon.